family members were doctors, and just following them, I see that they were very respected in the family. They were very respected people, and every person in my area will are giving respect to them. To see that great respect for the doctors in my family, I also get inspired that I must follow their path. I should also be a doctor, so that I can serve the humanity people, and also if I do something better, I will get the same respect as they are getting during my childhood. That was the main inspiration that will come from them. I fixed my goal to go into the to select the medical doctor's career, medical officer's doctor's career. For that, I have prepared from very beginning, from 10th onwards. I have started preparation for medical entrance test. My orientation was like that I should have anyhow I have to get admitted, get selected in PMDT, pre-medical dental admission test, and for that I have prepared. I have done hard work, and then I have been selected through MDAT. I got 85th rank in Bihar, and I got admission in Dhanbad Medical College, Bihar. And after completing my MBBS and internship house job, I have joined first service in Allahabad as a medical officer. I am there for 10 years. After that, one opportunity came towards me, that is in the form of senior, the post of the name of senior medical officer at IIT ISM. I have applied for that post, and I get selected here. Then I came here, and later on, after a certain duration of gap, I got 2 promotion at IIT ISM. And after first promotion, I am CMO NFSC. My second promotion was CMO SAG, means Chief Medical Officer, Senior Administrative Grade. So that way I am here as a CMO SAG. I am in charge also for 4 years, but I am regularly heading for last 18 years. As a SMO also, I am heading the medical department of this institute. Biggest challenges for the students, faculty and family members was their proper health care. Both, it can be divided into 2 parts. One is the prevention and other is the treatment. Everybody knows that prevention is better than cure. Prevention is a very cheap method, and treatment is little economically higher. It costs to the company. So we on both parts we have to take care of it, and challenges are there. Dhanbad is a place where coal industry was many coal industries are running around Dhanbad. That will cause environmental pollution also. Coal dust are drifting towards our campus from outside 10 kilometers away from our institute. That will cause first problem was very allergic problem. Allergic reactions to the body that ultimately leads to asthma. This is one of the challenges of this place. Other generally students, faculty members and staff needs medical care. We are providing initial primary health care was properly being treated taken care at this hospital. But again, for super specialty care, there is good facility was still not available at Dhanbad. Dhanbad is many new hospitals are coming in Dhanbad with they are trying to keep super specialist doctors, but till date we are lacking in it. So to meet these challenges, super specialty treatment is one of the great challenges for this place. For this we have arranged, we have just made agreement with many good hospitals of Kolkata, Ranchi, Patna, Delhi and St. Vellore, where we have our own, and actually Medanta in Delhi. we have agreement where so that our patients, students, staff, faculty, all can be get treated at these hospitals at CGHS rate. CGHS rate is very economical, so at a less cost, our employees, students, professors, faculty members will get better treatment. We have our health centers resources where there are two resources. One is human resources and another is financial resources. We are we are making a balance between these two. We have to meet the challenges of increasing number of students and their health care. Our director has taken a few steps. He has started emergency health care at our health center, which was not available previously. It came after 2011-12. First, that 24/7 emergency care was being provided by paramedical staff only, and in case of any difficulty, they will consult doctors of this institute, like myself and Dr. T. Banerjee. Both are resident doctors. We are residing inside the campus. But after some time, students started. They are not satisfied with the medicine given by the paramedical staffs. Then they start raising voice for doctors to be present at emergency care. For emergency care, doctors must be present. This is the students' demand first. Professor Rajiv Sekhar had just taken care of this demand. He had immediately appointed 3 doctors. Only these 3 doctors are focused only on emergency care. They were given shift duties. 3 shifts were running in our hospital. That shift starts from 7 a.m. to 2:30 p.m. Again 2:30 p.m. to 9 p.m. and from 9 p.m. to 7 a.m. in the morning. 3 shifts are running. All the shifts are all the shifts were manned by one doctor, experienced doctor, and our paramedical staff, including nurses, dressers, all that is there. In Dhanbad, we have many medical bodies like Indian Medical Association, API, Association of Physicians of India. Their branches are there. IAOH, Indian Occupational Health Association, and under other Orthopedic Association of India, Dhanbad chapter. There are many branches of many branches of medicines were being covered by many of the small organizations. They are regularly conducting CME, and we are on a regular basis we are attending these conferences, these small seminars, which is being held at Dhanbad. We are in that seminar we get updated. They are mostly being chaired by professors of SNM PMC of Dhanbad, Patliputra Medical College, or recently its name is changed, Shahid Nirmal Mahto Medical College. Their doctors were presiding the CMEs. Basically, they were the head of the seminar session. Then, so we are getting updated. Otherwise, our institute also send us to various important seminars being held in India. They were also providing grant to us. Most frequent cases in our campus, basically for students, is common cough, cold, diarrhea, vomiting, loose motion, diarrhea, vomiting, cramps, abdominal cramps, minor accidents. These are the mostly prevalent in our student community. In teaching and staff community, apart from this, these are the normal features of this campus, normal diseases. In students also, in typhoid is also prevalent in our campus. Typhoid, malaria, dengue, and other viral diseases are also present. Like some communicable diseases were reported. These are chickenpox and measles. Every year, during some seasonal changes, these outbreak of these diseases will take place here. During the rainy season, cases of diarrhea, vomiting will increase in numbers during that period. For faculty and staff, apart from these normal common diseases, they will suffer from many of them are suffering like diabetes, hypertension, thyroid problem, heart problem, heart diseases like MI, heart attacks, MI, some other cardiac diseases like left ventricular hypertrophy, etc. Asthma is one of the disease which is prevalent. Allergic asthma is basically more prevalent in our campus, in both the students and as well as our teaching and staff faculty officers and staffs community. Asthma is prevalent in all the communities. Allergic asthma. For prevention, it is we have to just take some steps. For this, just like many of the diseases are waterborne, so we have to improve our quality of the water of our campus. Certain instructions should need to be issued from time to time. Not to drink cold drinks. Don't eat ice creams or like that in the winter season, because many of the students were suffering from throat pain, sore throat, cough and cold, and we have found that in this year the cough and cold were persisting for more than 10 days. This is a finding of this campus. In many of the students, many of the faculty members, family members of the faculty and staff, cough was persisting for more than 5 days, which is generally not happened earlier. This is one of the observation of myself. Contamination of water will cause viral as well as bacterial diseases. The most important bacterial diseases typhoid and dengue. These are waterborne diseases. Other viral diseases are hepatitis A and basically hepatitis A. Jaundice is also took place when water is contaminated with sewage water. So these two are important ones. Other waterborne diseases are malaria is also waterborne disease. We have to take care of that also. That unnecessary water accumulation should not take place in our campus. That if it is somewhere some pits are there where water is accumulating, then we need to disinfect that water by just dropping some oil in that place, so that larva will die. So we also take care of source of water from where water is coming from. We have to take care of this water quality through our environmental section also. Our environment department can take care of that also. How is the water quality? They can check it. They can, or chemistry department in collaboration, they can just give us feedback about the water quality. Water quality is very important. Students are nowadays our students, everyone in our campus prefer to take RO water, but RO water is lacking in mineral. which is also harmful in the long run. So water is very important health factor. Is one of the very important health factor. We should take care of it all the time. So, we need measures to just check that water should not get contaminated. Our one sanitary department is also working on that point also only. They are taking care of it. Sanitary department. Technology has great help to the diagnosis, early diagnosis and treatment of the patient. That greatly help us. For simple example is CT scan and MRI. Previously, we are able to detect cancers, carcinoma in a very late stage. Now MRI, CT scan, ultrasound, many technological advances has come in our country. We are immediately, even in the first stage, second stage, we are able to diagnose the case. We are able to see the patients, and life of many of the patients can be saved by this technological advancement. That technological advancement also eases the treatment and care of our patient. Now instruments are available by which a unknown person can also measure their BP. They can also, with slight training, they can also measure their blood sugar levels. They can also measure their lungs parameter by pulse oximeter. Simple one oximeter you can, which is not available in the country until 2004. Everywhere, not available. A pulse oximeter was very rarely available in primary health centers. Now even every house has one pulse oximeter due to corona. So these are the technological advancements. By pulse oximeter, we have saved many patients during corona epidemic. So definitely these technological advancement has favored us in giving treatment to our patient. In terms of that has saved our time also. Previously we have plain X-ray. Now we have digital X-ray. In case of difficulty in diagnosing fracture, minor fractures, we can enlarge we have the ability to enlarge the picture and see even very minutely we can see that where is the hairline fracture can also be diagnosed very easily nowadays. These are all due to technological advancement. So these are greatly helping our humanity. We are imparting regular training to the paramedical staffs at our health center. We are regularly interacting with each other. They give some feedback to us. They take some feedback from us. Both way communication was, or every day both way communication was going on in the campus. Somewhere they were reporting our to doctors what is the case, what is the difficulty in treating, taking care of the case. And we are also understanding understanding the problem of paramedical staff. We are also suggesting some ways to how to give our medical facility to them. And we are really our staffs are very much very nicely very appropriately get trained in delivering the medical facilities to our employees. And they are also all our staffs are very much interested in learning new things. So we are doing at par with one of the best hospitals among our IITs. We are doing at par with them. Long-term plan is we are already providing. This is basically a primary health center. So what a primary health center can give to the patient, we are doing back home. But in future, we will see what the role of a specialist doctor at our health center. We are already have the provision of 35 beds in our health center to get patient admitted here. We have also operation. We have one OT is present in our health center. With the availability of the good doctors, we will start specialist care in our hospital. And in my opinion, super specialty care is not required in this health center, because with that will, even in bigger cities, that the cases were referred to highly specialized centers. So everywhere it is not available. But a specialist care, we need a specialist care. We are providing. Our health center was providing a specialist care to the boys and our family members of staff and officers and faculty members, but in a limited way. Right now we are doing one pediatrician was sitting here, one pediatrician, orthopedician, ENT specialist, gynae specialists are coming here, visiting our health center. We are also exploring for other new branches, doctors from other branches to come here, like medicine, general medicine, and one eye, ophthalmology. We are already exploring for that. Previously, when only 2 doctors are there, it was very hard to meet both the parameters. But with the time new director had come, he had appointed many doctors. So that problem of administrative overload was being minimized nowadays. Patients are equally distributed to the other many doctors. So administrative work was slightly easier to do nowadays. Previously it is very difficult to see the patient as well as doing administrative work was a tough task for this institute. But with recruitment of new doctors, this was very much normalized, and now there is nothing like overload of administrative work.